Hi, everybody. I wanted to take some time to go over our BLS practice review questions. We did go over this in class, but we went over it really quickly. I had you all look through the questions, pick your answer, and then I went through and said number one, B, number two, B. So this case, I want to go over it a little more thoroughly since we have some time home in quarantine, and probably you are too. So I thought I would take a little bit of time to go through this and explain it. In the FISDAP cardiovascular emergencies test, there is a pretty fair amount of BLS review. So it is a good idea to make sure you're really up on this. So let's go through this. I'm gonna highlight the correct answers. Number one, 60-year-old patient is in cardiac arrest. We've administered one shock at the 2-minute mark. We take a carotid pulse and we feel a strong pulse. What do we do? Well, first of all, that is called ROSC, return of spontaneous circulation. So when we achieve ROSC, the very first thing we want to do is check airway. Is our airway open? Is there anything in our airway? Blood, teeth, vomit? Is our tongue obstructing our airway? If the patient needs to be suctioned, we should do it at that time. If the patient needs an airway adjunct, like an OPA, NPA, we're going to do that. Next, we're going to move on to our breathing. So we're going to look at our breathing, our rate and quality. Do we have good chest rise and fall? If we do not, like less than or equal to 8, the next thing we do is provide positive pressure ventilation. So next, after those two things, next thing we do, want to turn the patient into recovery position, which is left lateral recumbent. So if we look at this, 2 minutes of high quality CPR. We do not continue CPR after we've achieved ROSC. Our heart is contracting and beating, so we do not need to do that. So that's not the correct answer. B, assess for breathing, manage airway. Yes, that is the correct answer for this question. It's the best answer. Do we want to put the patient in left lateral recumbent position? Yes, but only after we've managed our airway and our breathing. And cool the patient for transport, that is not in our scope. Next, the appropriate position for chest compressions. Elbows slightly bent? No, we want our elbows locked. Shoulders over our hand? Yes. It gives us a little bit more, the position gives us a little bit more ability to compress the chest. Knees slightly bent and always maintain positive pressure on the chest. That D is definitely a bad answer. We don't want to always maintain positive pressure on the chest. We need to have full recoil. The reason why we need recoil is because it allows the heart to fill. When we lift up on our chest compressions, we're allowing the blood to go back into the heart, and then we compress and try to circulate it again. So that is definitely a really wrong answer. So shoulders over hands, that is the correct answer for this question. Systolic blood pressure measures. So systolic blood pressure measures the pressure in the circulatory system in ventricular contraction. When the ventricles contract, that's the highest pressure in our circulatory system. The systolic blood pressure is the top number of our blood pressure. The bottom number is our diastolic pressure, or diastole. That is when the heart's at rest. And don't forget, the coronary arteries fill during diastole. Atrial contraction, no. Our atria don't really contract. They do have a little bit we call an atrial kick. They don't really contract. The aorta does not contract. That's the largest blood vessel in the body. It's really important, but it does not contract. And ventricular rest, that is diastolic or diastole. So correct answer here is A, ventricular contraction. During CPR, what is the most important? So deep ventilations, full chest rise, and fall. I mean, it's not a terrible answer, but I'm always uncomfortable with deep. Like we want to have good ventilations. We want adequate ventilations. We want a good chest rise and fall, but not too much. So I'm not comfortable with deep. It's not the best answer. Minimum interruptions during chest compression. Yes, yes, yes. 100 times yes. That is a great answer. Change person doing compressions every 3 minutes. No, we change every 2 minutes. So that's incorrect. Pause while the AED is charging. No, we continue chest compressions while the AED is charging. We pause when the shock is being delivered. So correct answer B, minimal interruptions during chest compression 100 million times. What electrical disturbances will the AED shock? Remember, we're looking at the things that are falling. The AED is looking at the isoelectric line, and it recognizes normal sinus rhythm, that it doesn't fall enough on the isoelectric line, will not shock that. When something is always on the isoelectric line, like asystole, a flat line that's just living on the isoelectric line, doesn't shock that. So atrial fibrillation, no. When the atria fibrillate, it's not great. A lot of people live with it. It is definitely compatible with life. Sometimes you get some congestive heart failure. Your heart has a little bit of a harder time because the atria, you do lose the atrial kick, but it will not shock atrial fibrillation. Ventricular fibrillation, yes. There's two rhythms most commonly that the AED shock: ventricular fibrillation, ventricular tachycardia. Don't confuse it with atrial, ventricular. Pulseless electrical activity, this is when you have a beautiful pattern of electrical activity in the heart. You have a P wave, QRS, P wave, QRST, everything looks beautiful, but the heart is not beating. So the patient, there's no contraction of the heart, there's no blood pressure, no pulse, but you can see a nice electrical activity momentarily. But the AED does not shock that because it looks like sinus rhythm. There's just not any contraction behind it. So AED does not shock that. So the correct answer here is ventricular fibrillation. Next, what do you do when the AED says shock advised? Okay, so again, I mentioned this in class for the testing. When the AED says shock advised, we shock the patient. If the question says you shock the patient 7 times, the AED says shock advised, what do? You shock the patient. Don't be tricked into thinking there's something wrong with the AED. We trust the AED. That's always the right answer to the question. So what do you do when the AED says shock advised? You shock the patient. So A, defibrillate the patient. Next, you are eating at Cracker Barrel. You notice an adult male collapse. He is pulseless. What do you do? So again, at the end of this question, you want to answer what do you do first, or remember what is the best answer. So open the airway and assess for breathing. Good answer. That's not what we do first in an adult patient with no pulse, no breathing. So attach the AED. We do want to do that. That's a good answer. It's just not the very first thing. Start chest compressions. Yes, always first. Whenever you do have a question, and you have to choose with a patient who's apneic and pulseless, and you have to choose between chest compressions and the AED. The right answer is chest compressions, get the AED. So we do want to do chest compressions simultaneously or just shortly after. So while you're doing chest compressions, another person is attaching the AED, or shortly after you attach the AED. But if you have to choose between the two, chest compressions is first, AED is second. But we really like them to be at the same time. So notify dispatch immediately. Sometimes people get hung up on that. Again, it's sort of simultaneous. In real life, you call out, call 911, but always the most important thing is chest compressions. What rate do we perform chest compressions on a 19-year-old male? So adult male. So is 120. You just have to know these. It's just fact. 6-year-old female is in cardiac arrest at a baseball game. She has been down for an unknown amount of time. What do you do? So again, what do you do first? So yes, we want to transport the patient to a good facility. Yes, we want to provide positive pressure ventilation. Yes, we want to attach the AED and analyze. Yes, we want to perform CPR while attaching the AED. So those are all good answers. If you have to choose between AED and CPR while attaching the AED, or if you have to choose between the two, remember compressions is first. So in this, even if it's a 6-year-old female, we do CPR while attaching the AED. Okay, I am done.